Hi, welcome to Health Sector and Queerness. I am Rishma from Rangeen Khirki Foundation. We are a youth-led feminist organization focusing on sexual and reproductive health and rights. We work with several marginalized communities, and it is through this work in collaboration with multiple individuals as well as organizations that we realized how most conversations around SRHR is extremely cis-centric. There's also such limited conversation when it comes to the experiences of the community when they access SRHR in specific and healthcare services, both mental and physical in general. Accessing healthcare facilities, dealing with mental health, ensuring a safe space, all of this is often a challenge for queer trans individuals trying to live their lives true to their identities. The intention of this podcast is to be able to create spaces where these conversations can happen without the shame and stigma that the community already has to deal with based on their realities. In our podcast, we have the privilege of inviting amazing guests from diverse backgrounds who have been kind enough to talk to us about themselves, their experiences, and their lives. Join us in normalizing the conversation, making it mainstream, and passing on the mic.
So, hi Prathyush, thank you so much for your time. It's great to connect with you.
Thank you.
We're so glad that you're here. Okay, so before we get into the main part of today's episode, here is a little bit about our guest. Prathyush identifies as a trans man and is currently working as a marketing manager for a market research company. He has completed his bachelor's in English from Hansraj College and further pursued his master's in fashion management from NIFT Bangalore. Hello and welcome, Prathyush.
Thank you. The pleasure is all mine.
So, do you want to add on to what we said? Do you want to tell us anything more about yourself?
Yes, sure. So, hi everyone. Let me introduce myself again. I am Prathyush, and so apart from my qualification, I'm a person who is very interested and lean towards photography. I have my basic major interest towards fashion actually started from photography, and it further grew into something professional, but the field has been different somewhere. Although yes, this my hobbies are photography, art, painting, Madhubani art. So that has been all about. And as a person, I believe, uh, you know, I believe in this policy of live and let live. And so since then, I have been pretty vocal about my thoughts and my opinions to people around me. So I more majorly believe rather than social activation, but more than that, I believe in the idea of cleaning or trying to make your inner circle aware than like the outer part. So that's been my thought process as of now. Yeah, and that's about me.
That's great to hear, Prathyush. That's so great to hear, and we're looking forward to see some of your art after this. Going ahead, let's start with the basics. You identify as a part of the queer community. So how has that changed your approach to issues of healthcare and medical treatment, if at all?
So as being part of the community, as it has actually legit taught me on being there and hearing your peers, peers who are part of the community, like they are so vocal about their thoughts, their opinions, and then you learn a lot. You get to learn how to be vocal about and how to be expressive about yourself, and how to stand up for your rights. So that has somewhat kind of sort of helped me, whereas I was a very shy person who would be very laid back or very scared of approaching any sort of medical facilities or thinking about anything, approaching any particular sect or any particular section in terms of which related which actually related me to come out or be more expressive in my own self. So any institution for that matter. So being part of the community actually helped me get out of that stigma of being held or being scared of letting yourself out.
Right.
Yeah.
So, Prathyush, you talked about being scared of, approaching a medical care facility or a medical care professional. And so, what is your thought process when even now, you say that you feel a lot more confident because of the community. So what is your thought process now, and as compared to what it used to be while you're about to visit a hospital or a healthcare professional?
So it's majorly, it majorly revolves around the idea of how the other person would perceive. So for a person like I'm a trans man, and I have like major, like it varies for different people, but I have major dysphoria, and that major dysphoria arises from the fact that how the other person identify me as, how they the kind of pronouns that they use, how they even try to approach me as. So the initial stigma that comes into my mind while approaching a medical facility is that the category that they divide, like how they put you in a category of a particular gender, right? There's no other category which would make a person feel more safe or feel more welcomed. So I have to generally, like whenever I'm approaching a medical facility, I usually have to go as a identify as a female and approach them with that, because these any medical issues that arises, they have to be like related to a particular gender or a particular genitalia, right, for that matter. So this becomes a very tricky situation, and that has and this is the only area which actually puts me in a lot of you know problem or issues in my own head. So I'm like I don't usually go. So that's one of the major reasons I never approached any medical facility for that matter, because it's just something which I do not feel welcome, and it's an area where you have to put yourself in a particular box, which is what, like a very like just pulls down your energy. So that's
Right.
one thing.
And would you say that this heteronormativity in medical spaces has ever led you to avoid visiting a healthcare unit altogether? Like, have you ever chosen to avoid visiting a doctor at all?
Yes, I have for the longest time. So basically, I'll tell you this one particular situation. For the longest time, so I have a lot of burns in my leg, bottom area, and that happened due to a little accident that happened in my childhood. And I have major burns. So as a child, I was not allowed to get it treated because of the heavy operation that was supposed to be involved. And for the longest time, but they suggested me to get it operated or remove the burn marks removed after I like reach a certain age, so it would be less painful. But what happened was, like, I was just avoiding that situation for the longest time, because I would have to show my the thigh area, and certain way where it would be just operated, and where I would be treated a certain way. I have to be like very shy, and I am approached as a girl. So that was something which was holding me back. But when I finally visited, it did put me in a box, one thing, and that heteronormativity was something uh, you know was something like pulls you back in taking certain actions.
All right. So, continuing with this theme of heteronormativity in medical places. So, Prathyush, can you, when you visit like a hospital or a clinic, what are some of the things that that you have to face? Do you ever feel unwelcomed in these situations because of your gender expression?
So whenever I approach a medical facility, I don't have I cannot be myself there. I have to go with a pretension, I have to pretend to be someone I'm not. I do not identify as. So I just put on this veil of being a woman, and then I approach any medical facility. That's the most uncomfortable part for me, and because I have to, and for the the idea that that I might be I might get certain weird looks I if I go as a person I identify as, is what kind of breeds me, because I don't want to be I'm not very comfortable. I see a lot of people who identify themselves as, and they're very comfortable in their own skin, right? And then they express themselves very wholeheartedly. But whereas it comes to me, I quite dread the idea of how a person would perceive me, how the other person would even talk to me when I fully express myself.
Right. I mean, you talk about being uncomfortable, and it only makes one wonder that how does feeling uncomfortable with approaching basic facilities, how does that have, what kind of impact does it have on your mental health? Do you feel that your queer identity or its perception and impact on your interpersonal relationships has affected your mental health?
So yes, it has, for the major part of my life. I have tried to also approach a medical facility for this particular matter. I've tried to take counseling. So again, the kind of sensitivity that you expect from a medical facility, that does not come. You just end up having no expectations from people. You think everybody falls into that same section. Nobody would be understanding, and I don't know, for me as a person, I couldn't express myself for the longest period of time. So I would just express myself as someone. I would just try to fit into their shoes and try to express myself as they see me as. And yeah, my surroundings or my areas, it does affect my mental health. But I've tried to, it has only bogged me down further, in terms of how I'm not able to express myself fully. And it's something you want to be there are certain, I really appreciate a lot of people who are so bold about expressing themselves, how they identify, and they're very outspoken about it. Whereas it comes to me, my experiences in these terms have actually bogged me down. So I'm not very expressive and bold when it comes to that, because of how I constantly feel.
One would expect a mental health professional to be more understanding, or understanding of a person's situation, but as you tell us that even mental health professionals are not free from all kinds of judgment. So do you feel that there is a need to improve the way people view this issue? What is the way forward, in your opinion, for making not only mental health professionals and and doctors, but also people in general? What is the way forward to make them more sensitive towards the issues of the queer community?
Right. So I just have a very a very short sentence, or a small thing to say. You know, not a lot of things come from knowledge, bookish knowledge. You might one day read about a topic and you would try to execute that in your daily life. It does not happen. It happens when you are actually, when the learning happens with certain, being exposed to exposing yourself to the environment which would actually educate you. I have always been a firm believer in that, where education would not come from books. Education comes from people. If you really are intrigued to learn about the topic, or like I myself, learned a lot about different gender identities, sexualities. I learned that from people around me. They taught me how there are so, I exposed myself, like I was uh, for me being a really, I was not a social person, but uh, I did make an effort to uh, go be part of the community, go to parties, queer parties, which would help me educate myself to come across a lot of people who identify as a different gender as mine. And it's something that helps you educate yourself and how to be very sensitive to people around you. So it's the more than reading on a book. You'll just remember it for a day or two. But when you actually come across people who are from different backgrounds, who are from different who identify as different gender expressions, that's when you learn to be sensitive.
That was short but profound, very profound indeed, Prathyush. And so, what is your vision for our society? How do you see us? What kind of society do you feel would be more conducive to people being able to express themselves, people being able to identify truly as who they are in public as well as in the confines of their safe spaces?
I think the only way towards it is people being non-judgmental, like people not caring how the other person is actually, or people just showing less interest in other people's life, um, in terms of how they are, how they present themselves. You just be normal towards it. For me, I felt the most comfortable around people who didn't really care how I express myself. Who they were just, to them, it's just, you're just another human. So you just treat everybody as a human rather than person belonging to a particular category or gender. So that goes as a whole to anybody, not just a person identifies as a gender person from the community, but it goes to someone who comes from comes from a section, a lower, comes from a very a section that has been deprived for the longest, anything like that. So for that matter, I would say it's just, I see a society where humans treat each other as humans. Other than that, nothing else. There should be no label as such which would categorize them or divide each other. It's just a human. That's it.
Wow, that was a very interesting perspective that you've shared with us. Thank you so much, Prathyush. We have learned so much from you and from your journey. Thank you for sharing your perspective. Thank you for choosing our platform to share your perspective. And we truly, truly are honored to have you share your journey with us.
Thank you everyone for joining us for this episode. Here's hoping that there will be more safe spaces created to hear and ponder on these experiences and work towards the required changes in the legal, educational, and healthcare institutions. To know more about the work we do, follow us on Instagram, Twitter, and LinkedIn. To hear the full podcast, subscribe to our channel on YouTube, and we will meet you next week with more anecdotes, stories, and experiences.